All right, Dr. Emer, we're live.
Hey you guys, it's Dr. Emer. I am now doing, we wipe the upper lip a little bit. I'm now doing the CO2 portion of our treatment. And it's gonna be a little different looking to you guys because there's serum on the skin right now from the pixel. So it's not gonna be as frosted looking, but it's still working really hard. This laser is our ablative resurfacing. It's definitely more painful. So I'm trying to get her through it well. She's doing really, really good. We are now doing full face. And she has a lot of deep scars, so trying to do kind of closer overlap. Hold on, turn your head a little. There you go. Perfect, just like that. So we're doing closer overlap because she has deeper scars and a pretty high density. She's light enough skin tone. So Jordan, what are they saying?
A lot of people are just tuning in right now, guys. You guys are coming up from our previous live. We did our microneedle radio frequency previously to help retexture the scars, stimulate some collagen production, and it's also going to tighten her skin quite a bit too. What's the name of this machine, guys? We're using our Ultra Pulse CO2. This time we have many CO2s. We love them all for different reasons.
Exactly. Now on her, this is tried and true. This is one of the best CO2 lasers that is out there. It's really good on her lighter skin tone. Pretty predictable on a 1 to 2 week healing process. And then with peakness, that will go away slowly as the weeks go on. You can always get a little bit of striping. She probably will see that in a week or two. It'll go away within a few months. Covering with makeup will be easy. You guys could see with the lighting that the frosting is a little easier to see. You see that this is a pretty high density. I mean, we're really getting a good amount on the skin.
What does this do with the skin?
So this makes the skin peel. This is a lot of deep heating. The deep heating is gonna allow us to remodel the skin so her scars improve. It's gonna obviously remove sunspot and wrinkles, but she's younger, she doesn't have those. So this is going to get those scars, improve them, at least the starting process. Her scars are really deep. That's why we did the deep microneedling radio frequency as well. Downtime will be 1 to 2 weeks. Within 5 to 7 days, people can go presentable. But it's going to be a few weeks of healing and then redness afterwards. Okay, go ahead and wipe off the rest of this part. I'm going to continue to work around her lip area. And so what I'm trying to do right now is our global field. So we're doing now the chin. She's doing really, really well. If you want, you can hold the air to your right side of your face now. There you go. Turn to the right now. To the right. There, right. Keep going. Keep going. I know it's hard to remember. Right there. Good. Perfect. Just like that. So you guys see, I'm really focusing the beam with a good overlap. And this resurfacing is the strongest on the market besides the J Plasma resurfacing, which is really much more superficial. Not as good for the deep scars.
Someone's saying they're in North Carolina and they want to know somewhere good to go over there, guys.
Tell her to come see us in New York or Boca.
Come in New York.
Or Boca.
Or Boca Raton, guys. We're there every 2 months. We're going to be back in New York in late March. We'll be in Boca Raton, Florida in April. Sorry. We were just there.
And we can
send you the skincare ahead?
Send all the skincare and the stampers. So definitely do a virtual consult with us right now. You guys can see it's very important to be meticulous. Turn all the way right, and we're turning. There we go. Perfect, just like that. And this is her first big treatment, you guys. So I'm really excited because there's a huge potential for big improvement here. And doing this big treatment with the Pixel Plus is really going to make a difference. Why don't you show them, since this is a new viewership, what she looked like originally, and then what she looked like right before we did treatment.
Okay, here is our original
Turn
picture
right a little bit
here.
more. There you go. You're doing great.
Take a look, guys. And now let me show you what she looked like before we just did treatment today. So this is our before treatment today. Alright, here, guys. She did prep with a chemical peel from cosmetic.com.
And skincare.
There, guys, and she's going to post it as well. Let's see questions are popping in now, of course.
Now we will follow this.
Guys,
How are you doing on pain level? What would you say? I know you're really strong. Like, what would, she's really good. So better than most, I will say, but I also think she's like super motivated. I think a lot of it's mental. I think like when you're ready to do this treatment, and you're prepared and you really want a result, you just get through it. And I think you don't have to spend the money or the risk to go to sleep, under anesthesia or anything like that.
This is a fully ablative laser.
This is a fractional ablative. We can make it fully ablative, which is what we've been doing very closely with the Roar device. If you guys have seen any of our videos, tell them about the Roar device.
Guys, our Roar device is made. You guys do have some great results from Roar Aesthetics with our Phoenix laser. Very strong laser, but it does offer those results.
It just requires a little bit more downtime to move this down. Okay, right there. Perfect. Let me turn you a little bit more. There you go.
Están haciendo un laser para hacer los cicatrices después del acné, no es mejor.
Thank you, Rosa. It's like Vanna White over there. Rosa's our official political translator.
How many procedures do you need to be done for final results?
Okay, bring her straight. Let's wipe off her forehead. Well, that's a good question because, yeah, because I'm going to do a little more on the right cheek. I'm going to do a little bit more in a couple spots that she has deeper scars. It depends on, it completely depends on the scars. Sometimes you need another one of these even in 6 months. So
you got to see,
we have to know. Yeah, exactly. We'd have to evaluate to really determine what's best.
Guys, if you have our team evaluate you, get a consultation, guys. Our coordinators would love to speak to you. Send a DM, full name, email, phone number. We'll reach out to you. What's the name of this treatment, guys? This is a acne scar combination treatment. We treat acne scars with very powerful combinations that only Dr. Emer does, and we make them safe. This is going to be our CO2 laser, is the part we're on now.
Okay, so now we're going to go to the forehead. I'm really excited. I really want to see a big result for her. I think we're going to get it. You guys could see, I mean, this is very strong fractional. And with overlap, it makes it closer to, complete ablative, but it's not fully ablative. The reason we don't do fully ablative as much anymore is there's risk of hypopigmentation. Not hyper or hypo.
Someone said, I did a fully ablative laser before 6 weeks ago. I'm still waiting to see my results. What do you think about full ablation?
Well, fully ablative doesn't go deep. So if it's deep acne scars, that's not the treatment for you. You need to come in and do the combinations of what we're doing with like the Pixel that goes much deeper, and this CO2 which can be set to different depths.
What is the name of that laser, guys? This is our Ultra Pulse CO2 from Luminous.
Exactly. All right, turn left now for me. We're really learning left and right today. Again. Will you move that band? Okay, let me turn you here. I'm going to go back to the middle now. You guys see we're really being complete. Doing really good, I will say. Very good. So the combinations are really what's going to make it the best, and you guys, it's really important when you're doing this, you have very good eye protection. So take a look at our goggles over there. Those are our innovative optic goggles, and they have my Instagram and their Instagram because I helped collab.
What is the name of this torture?
This is the CO2, but she's not tortured. Look at her smile for everyone, if you can. It's hard for her to smile, you guys, because she has nerve blocks on. Her boyfriend's watching, thinks it's funny, okay? She's not that tortured. She's actually doing really well. But she also is really good with pain, and she's very motivated. When you do these types of treatments, you have to be really excited and not nervous, because otherwise it makes it way more difficult procedure. She's like super excited for it, so. Okay, turn to the right. There we go. Beautiful. We're basically almost done. Show you guys this overlap here. Now I'm just gonna do the nose. Bring your head straight again. We're gonna just do the nose really quickly. And then with the nose, we
Your
just
friends are on here saying that we are here with you and good job.
Oh, that's really sweet, actually, to be honest. So I'm going to take good care of her. Our team is going to take really good care of her. The key with this, you guys, is patience. You just have to be okay with the downtime and the healing and understand that it does take a little time to see the outcome, okay? And I know everyone wants to see it immediately, and that's not how it works with skin. Skin needs time to heal, and some people get more red, some people get more little lines, some people, everyone's different. So, turn to the right. There we go.
It's her mom on here.
Oh, hi, Mom. Don't worry, I'm treating her like she's my sister, and I like my sister. So, you guys see we're being very thorough. She's being very good. Very, very good. Doing really great.
What does it look like when healing, guys? We have several examples on our page with us healing from CO2 lasers. All different skin types, all kinds of scars. You guys check them out. We're going to post a really great one after this live. You guys are going to be amazed. It's from one of our great patients in Boca.
Okay, now I'm going to do just a little feathering. Turn to the right a little bit more. I'm going to do a little feathering at the edge just to blend everything. And I'm just checking now that everything is done. So we got all the areas we wanted covered. Nothing's neglected, sorry. Now turn this way. Beautiful. Okay.
All right, guys.
Give this to my team. We're gonna now put our PRP on. Hold on. Everything looks really good. Just keep your eyes closed a second. Now put the air on your face. So now we're gonna get cold air on her. And then Rosa's gonna put on her PRP. So if you guys take a quick look, you guys can see all the little scabs that will form. This is a good starting point. Now we're going to put on our growth factors and our stem cells to help her heal. We're going to be really careful not to de-char the skin. We want to keep the skin that way. And then we'll see her results as she heals over the next few weeks. Excellent. Very good. All right, you guys, that's the healing protocol. See you guys soon.
Are you feeling okay?
Yeah, good.
You did amazing. Wait, every time the lights are, they kind of like this.